So there are different versions of how evidence-based practice is actually implemented. Okay? But I chose this one because this one looks easier and you can easily remember it. Now, the first thing is that you need to have a mindset of always asking questions. So that's the first thing. Ask. Well, every time you interact, every time you do things in your office, you need to always ask yourself, is it the best thing that I can do? Okay? So, with asking, you are basically looking for evidence to a question that you have asked. Now you go and read, you go and look for the evidence. And often, you look for this evidence by reading. So you go and conduct literature review. Okay? Literature review. Or you can inquire, basically. So looking for the best possible evidence. After you have gotten the evidence will be coming from multiple sources. So you need to be a good judge of evidence and say, okay, this one is saying this one is saying that, this one is saying that, but I think this is the best course of action. So you are basically judging or evaluating evidence. So that is step number 3, which is appraise. Appraise is to critically evaluate evidence. Now, when you conduct, for example, when you conduct research, you publish your work. So within that area where you have done that research, you have different articles about that area. So for me, when I'm looking for literature, I will get all these articles and look at them. But I will have to make a decision which of the articles or which evidence is actually the appropriate evidence. And look into the books, the journals, ask colleagues, and things like that. Basically, you're gathering evidence. After gathering this evidence, you'll have to weigh this evidence. Weighing evidence is what we term as appraising. Appraisal is about critically evaluating the evidence to find gaps in the process of how that evidence came about. Now, when you conduct research, you document everything that you did and why you did it the way you did. So when someone comes and reads your research paper, they are looking at this methodology to identify gaps in the methodology. Because this methodology is what gives us the evidence. So if the methodology is poor, the evidence is also poor. And then you conclude and say, okay, this evidence is good, this one is not good evidence. What we often term as strong evidence, weak evidence. And this depends on how rigorous your research was. Now, getting evidence is not enough. You need to apply this in your clinical practice, or generally in your practice, because not every practice is clinical. So you need to apply the evidence. Now, when you apply the evidence, you need to see, okay, has it improved the situation? Or it has not. What do you need to adjust? So that is the refinement process, and that is the last step, which is assess. So that is how evidence-based practice is conducted. Now, not all evidence is equal. This is basically to say that you need to have eyes to see which evidence is actually good. And we are saying that evidence comes from good research. If you don't have good research, you don't have good evidence. If you don't have good methodology, you don't have good what? Good evidence. So the levels of evidence do vary, and we shall look at what we call the hierarchy of evidence. Again, there is an assumption that when you conduct research, you need to publish. And therefore, when you find published work, there is that assumption, which is a myth, that actually published research is actually good research. The truth of the matter is that it is not true. You can also have people who publish research and that research is not good. We have what we call research mills, or we can call them predatory journals. So predatory journals, the word comes from predation, a predator, but predatory journals. So predatory journals are those journals that for them, they make it very easy for anyone to publish their research, such that they can get money, because when you're publishing research, you have to give in some money for reviewers and things like that. So for them, they're interested in the money, they're not interested in the quality of the research. So you have work that is substandard being published in journals, and those journals are the ones we call predatory journals. So not all published work is actually good work. So how you conduct your research determines the level of evidence that you have. High quality research, let's move to this, is up here. As you move down, the quality of the evidence lowers. Low quality of evidence downwards. When you're moving up, the quality of evidence improves. So the highest level of evidence you can ever get is when the research was actually reviewing what we call randomized control trials. So systematic reviews or meta-analysis of randomized control trials is what gives you the best level of evidence, the highest. So what does this mean? That you're looking at all the randomized control trials on a particular topic, and then you look at the evidence that they have. So that is what you call meta-analysis or systematic reviews. Now the next level is randomized control trials. Also, they give us good evidence. Cohort studies give us good evidence. And then you come to cross-sectional. Now, downwards, or people's opinion, expert opinions, editorials, they give us the lowest level of evidence. If someone says, I think this is what we need to do, that is an opinion. Okay, so opinions, expert opinions, regardless of the qualification that they have, that is the lowest level of evidence that you can ever have. And then we have what you call mechanistic studies. We have case reports, case studies, and then the cross-sectional studies. So as you move up, the quality of evidence improves. As you move down, the quality actually decreases. Why? Because you have higher bias down compared to up. The reason as to why we have randomized control trials up here is to minimize bias. Okay, so we'll look at the different types of these studies that we have just talked about subsequently in our interactions. Okay, so not all studies will give you the same level of evidence. So if you have an observational study, it will give you some evidence, but it will not be the best evidence that you can ever have. Now, critical appraisal, this is evaluating and seeing whether this evidence is good and can be applied. Okay, so basically when we are evaluating research articles, we are doing what we call a critical appraisal. Okay, are the findings valid? Are they important in this context? Can I use them? Okay, those questions and many other questions you have to ask yourself before you apply any findings. And that is critical appraisal, and we shall look at how critical appraisal is actually done. So after getting the evidence, that evidence has to be, so for example, it has to be put into practice. So for example, you had a question, and that question was, for bed showers, what is the best type of dressing that we can apply for bed showers? That's the question that you have. So what do we use for dressing these bed showers? So that's a question that you have. So you go and read. Now, when you go and read, you will come up with different what? Different evidence for the different types of dressing that can actually be used. Now, you can choose one. I mean, after evaluating all this evidence, you can say, okay, this is the best evidence that we can use, and we can apply this in our ward. So usually, you will have to tell the health workers to change their routine. So for example, they can be used to a certain type of wound dressing, and now you're telling them to change to another. That is difficult. So you have the evidence is saying this, but the people in the ward have not been used to that. So that is why we are saying that implementation, putting evidence into practice, is often the most difficult part. Okay? Because people will always resist change. So what do you need to do? You need to engage them. Okay? Because if you just come up with a policy or send an email, the things may not really work. Okay? In the hospital or in the health facility, there should be a culture of always wanting to improve. And this culture, you actually have to, this culture is instilled, it does not come from blue. The environment needs to support that. Supportive culture is a culture that rewards change for the better of the patient. Okay, so these are examples of initiatives, evidence-based changes that can be implemented. For example, you can say, okay, for every patient who is ventilated, the frequency of doing mouth care should be 4 hourly. Okay, that's what the evidence is saying, because it will reduce pneumonia mortality and also improve on the costs associated. So you make sure that that is what the people in the ward implement. Okay, it's the same thing that can be introduced with issues to do with warm water compresses for nipple pain for breastfeeding mothers. This can be an intervention that has been proven to be effective. And now, how do you tell people to implement it? Because that is what the evidence is basically saying. Okay, so translation of this evidence into practice, and also it being culture of the organization, requires a number of things. So translation of evidence, often another term that is also related to this is what we call knowledge translation. Okay, sometimes we who are in the academia produce research for how certain things should be done, but if things are not done based on the evidence that we generate from this research, then we are basically doing nothing. So there should be what we call translation of evidence. To produce evidence, this evidence comes from different studies. So the users of this evidence will have to synthesize this evidence, implement this evidence, evaluate, and also share this evidence with other people. All those things actually involve what we term as translation. Okay? Because at the end of the day, evidence-based practice is aimed at improving things. We need to improve the way we do things, the way patients are cared for. Okay? So it's about improvement. So if we only generate evidence and we don't implement such that we can improve processes, outcomes, then we are not doing the right thing. Okay? So that is very, very important. And also, in the wards or in healthcare settings, we have what we call protocols or clinical guidelines. These one often tell people or health workers what they ought to do when they are faced with a particular situation. Now, those guidelines are also come from they come from research. Okay, those guidelines as a result of research, and they sometimes help us in deciding on what is the best course of action. But also, you should have an inquisitive mind also to question some of the things that are in clinical guidelines or clinical protocols. Okay? So that mind of always asking yourself questions is very